Nigeria's mentally ill population is said to be the forgotten ones, and this is due to the lack of adequate facilities and government interest to cater for their peculiar health challenges. The situation is made more complex for the atmosphere of shame and stigma surrounding the mentally ill and their families. In this report, AIT's Kelechi Ekeledo narrates a situation in one of the mentally ill homes situated in Umuahia, ABIA State.
Justin is a 37-year-old mentally ill patient. He is one of the residents in this mentally ill home located in Bende, Council area of Abia State. Few months ago, Chijoke, who is a university graduate, was roaming the streets before being picked up for rehabilitation at the ITUMBAUZO Center for the Mentally Ill Destitute. At the center, several others like him are undergoing different forms of treatment and are held here for periods ranging from 6 months to 3 years. Specialists here attend to the patients, and sometimes visiting consultants come in as well.
It's difficult to know the actual pre-morbid personality, what type of vet. We start from what we can get.
Our job is a calling from God.
The center here operates community living. This sound of the bell is a signal for lunchtime. The patients, staff and visitors eat from the same source. The specialists tell us that this has a healing effect on the patients. With little government support, this privately run center, founded in 1989 by a British missionary, Rosalind Colwell, remains the only major center for treating various cases of mentally ill patients in the state, and also serves as a reference point for mentally ill destitutes from neighboring Southeast and South states. The road leading off to the center is in such a bad state of disrepair, much like a death trap, and has stayed the same for many years.
Our vehicle is breaking down every day on daily basis. People who want to come to the center to visit us, to give us donations, to support us, they cannot come.
To go to Amaudo is like going to hell. And year in, year out, we cry about this.
This as much speaks to the condition of the mentally ill in the society as the forgotten ones. Besides lack of government support, there is a general perception by many here that mental illness is caused by the supernatural. Most locals blame evil spirit, witches, and even God.
That accounts for, in this climb of the world, people still take their mental ill ones to the churches or to herbalists.
Ancestral powers in their community can also cause something like that.
And so, instead of referring the ill for clinical help, families or sufferers prefer to take them to traditional or spiritual homes.
At times, it depends on the parents of the person.
For others, their mentally ill ones are locked up and kept away from society due to the shame by family members. This speaks to the urgent need for an increased awareness on mental illness and for government to fund and provide remedies for the sufferers. For now, care for the mentally ill in Abia State remains a humanitarian service by organizations such as this one. Kelechi, Ekeledo, AIT News, Umuahia.
Welcome to Sports Track. I am Lai Lawal. Team Delta, for the 5th consecutive time,